is Kevin Stout, Social Media Manager at Medical Economics and host of Medical Economics Weekly. We're here with Dr. Lyle Dennis, founder of HealthKeep, a new health social network. Dr. Dennis, thanks for joining us. Can you start us off by telling us a little bit about HealthKeep?
Yeah, so the very simple version is HealthKeep is a social health network. Just like Facebook is a social network, this is a social network whose sole purpose and function is to focus on and improve health. And so that's, sort of the simple version. A little longer version is you can imagine what a personal health record is. There have existed online digital personal health records where people will go and enter any symptoms they might have or tests results that they have. And good examples of this are like Microsoft Health Vault, Google Health, which obviously shuttered a year and a half ago or so. But those endeavors are very one-sided. You sit there and you enter your data into the system, and that's kind of where it ends. So it's kind of a little boring, and perhaps for some people they may not really understand a lot about what they're putting in there. HealthKeep adds a new dimension to that. So you're basically creating your own personal health record, but every time you enter an element in there, let's say you have a particular diagnosis or a symptom or a medicine you're taking, as soon as you enter it into your health record, you're immediately connected to every other user who happens to have that particular health item on their health record. So you now have a social health network based on your health records, which I think is a very powerful way of people being able to share with each other their experiences, their questions, their answers, their advice. And what we're doing to make it that HIPAA compatible is everybody is anonymous. So it's not like I'm sharing my real records with the world. Nobody knows who I am. There's no personally identifiable information, no actual name, no actual picture, no actual medical records. So it allows all the social tools that are available to us nowadays without any fear of personal discovery, of loss of confidentiality. Yeah, well, you can easily see that there are certain diseases and symptoms that are very, very common just in general. I mean, there's 140 million adults in the United States, and about 100 million go online every year to look for health information. So it's a very huge market of people. We all care about our health. I mean, health comes first. You could be a billionaire on your deathbed, and all that matters. Your health is what matters first. What you'll find is that the most common things are the most common things. So, things like back pain and headache are very popular. Diseases like diabetes, hypertension, and obesity are very popular. So the things that you'd expect to be most commonly found are the things that are most commonly found. But we have the advantage of having what's called the long tail, if you're familiar with that concept. And so certainly if there's two people that have this condition and they both wind up on HealthKeep, then they already have a little community for themselves. So even if it's something that's very rare, nobody is excluded. Any condition can be added to the system. I think one of the other tools that are going to be available to people are, when you wake up with a new symptom and you go online and you type into Google, hey, I have this blood in my urine this morning, right? I type it into Google, and Google says I read Google and I determine, and studies show, the majority of people will determine that they have cancer. At least there's enough of a concern there that they start to worry about it, right? And now they've got to have anxiety until they can finally get to the doctor and then schedule that CAT scan or the cystoscopy or whatever test they're going to get. And then weeks go by and finally they find out, oh yeah, it was just nothing, But so on HealthKeep, you go in there and you type in, I have blood in my urine, and then you're going to see a stream of everybody else who went through the same thing already that you're going through. And you can see, hey, wait a minute, 90% of the population, and we're going to have population statistics, 90% of the population found out that it was benign hematuria, that was not anything of any concern. And then you'll realize, hey, there's a 90% chance it's no big deal. and you'll still worry, but you'll worry less. And I think that that is really the value of HealthKeep, the potential for reducing anxiety and giving people useful, valid information, where I think that the traditional, as wonderful as Google is, it's just not really serving health needs that well. Yeah, so the interesting thing is, I think when you started off, you sort of called it, I think, a patient social network, but it's really more than that. It's really what we're calling a social health network. So patients are people, let's say, with chronic disease, well people who want to stay well, maybe they wouldn't even call them patients, can participate. And we have physicians and healthcare providers and healthcare institutions and healthcare news sources, media companies. And so the physicians, we have a profile for every practicing physician in the United States on the database. So if you go in, you can add your doctor to your timeline. We call it your health timeline. That's your personal health record. And so you can enter, I have a doctor visit with Dr. X, next week, and you'll be following that doctor. So you have the ability to find and follow doctors on here, even if the doctors haven't yet claimed their profile. So we're in the very early beta stages now. So we have some claimed profiles, but obviously they can all be claimed if the doctors come on board. But the feedback I've gotten so far from our early initial doctors is very positive, because doctor myself, this tool, I created it with myself in mind, like how could I benefit from this? And what you have is the ability as a doctor, you also choose certain diseases or symptoms or medications to follow that you're interested in because they're part of your practice. So as a neurologist, I might follow Parkinson's disease or multiple sclerosis, let's say. And then when I go on there, I get a feed. So that's the way the system operates. Once you've added all your data, you log on and you'll get a personalized health news feed. And like a Twitter feed or your Facebook news feed, you basically see all the latest things that are happening relevant to you. So if there's a news story about your disease, or as a neurologist about a disease I'm following, there's a breakthrough news story, it'll be right there in my feed. Or if people are discussing that particular symptom. So it'd be interesting to me to see, oh, these are what people with multiple sclerosis are talking about. They're patients, but I can have an insight into what they're talking to each other about, which is different than my experience as a doctor sitting with a patient in an exam room, what they're going to tell me and what they're really thinking about on their own time. So it's a very powerful tool for doctors as well, to gain insight. And some of my colleagues that are using it really find it a great way to follow the news. If there's a new drug, a new FDA approval, a new piece of research, boom, you'll have it in your feed. We have a dozen news feed sources that are basically inputting into HealthKeep, and we're building out many more connections with a lot more news sources, and the news is basically parsed and categorized in terms of what it's about, so it winds up in the right place for the right people. Yeah, well, we have secure socket layer, security, encrypted data, and we use the latest sort of coding techniques that are the same, that basically hospitals use for their servers to maintain the privacy. But again, more so in hospitals in that situation, people they're really storing genuine. Okay, here's my name, here's my social security number, my address, my phone number, my date of birth. These are all the diseases I have. It's very specific, personally identifiable information, and so the government holds them highly accountable with the HIPAA law. Whereas in HealthKeep, once again, we don't have any. We never even ask you for your name. We don't want to know. So we don't have anything personally identifiable that can be breached. So the security level is the same, but the actual quality of the data is quite different. All we know about an individual is that they say they're a 60-year-old male that lives in Ohio, that's it. I mean, how many of those are there, and how do you know who it is? You don't, and we don't know either. And I think that's really important. You know, we're dedicated to this mission of anonymity because we want people to feel free and open. Patients can follow their doctors. So as doctors become more popular on HealthKeep, as their patients register, some doctor may find, oh wow, I have 100 of my patients following me. They won't know who those patients are because, again, with the HIPAA rule, very important. But they'll know that they have 100 people following them. So they then are in a position to say, hey, you know, this is a really important story that I just learned about in treating this particular disease, and here I'm going to share it on my stream, and then all my patients will see what I have to say. Or, you know, I may be opening evening office hours or something. So it's a platform to share with one's patients or the people that are interested in them as well. It goes back to our core mission. And, you know, we know that startups nowadays, that they're social startups, they capitalize on the large network of Facebook, and they have the frictionless Facebook login button. And we have specifically chosen not to do that for the very reason that we don't want people to have any fear that, you know, you never know when you click that Facebook button if something's going to leak out onto your timeline. You know, you just never know. And that uncertainty, I think, will inhibit people from being free to share what they really want to share. So unfortunately, you know, even though it's a great way of building the network, I think we're specifically decided against that for the reason, again, of privacy. At this point in time, we have no plans to put any advertising on the site. It's just about, you know, just providing a place for people to share and for the network to grow. I think once we reach those large critical sizes, then we can begin to offer opportunities, offers for people that are targeted to their needs. If somebody has back pain, perhaps there might be little targeted opportunities for massage coupon or a chiropractor coupon or a doctor who specializes in back pain. So we'll be able to offer valuable, focused offers, and I think that would be a source of revenue down the line for us. And we would also like to see the ability to you know, generate big data for pharmaceutical biotech companies. You know, these are users who have, you know, diabetes, and this is the most common medication they take, and this is the most common symptom. So useful information for pharmaceutical companies to use to develop new treatments. So again, doing good. You know, we really want this to be something that helps people. You know, it's not just about making money. It's really, what can we do to really help people and you know, make money. Obviously, you can't have a company that doesn't earn money, but, you know, the trick is to do it in a way that it really does help people. Also, the ability to have offer clinical trial enrollment. So, you know, people with specific diseases, there might be a new drug trial, and so we can offer that. And certainly, the drug companies would pay for the recruitment. So there's a lot of opportunity for revenue down the road. We're really at the seed funding stage now, so any Series A is down the road. We're looking to, you know, raise you know, our seed round now to get us through the next 2 years. We are developing our mobile apps. So right now we're web-based, but, you know, we're accessible on mobile browsers. You know, it's responsibly designed to work well on mobile devices. But we are working on native Android and iOS apps, so look for those in the coming weeks.